If you're a breast cancer survivor and you either have radiation therapy coming up, or if you've already completed it, keep watching this video as I guide you through 5 exercises to improve and keep your mobility. I'm Dr. Alex Hill. I'm a board-certified oncology physical therapist and a certified lymphedema therapist. Make sure you subscribe to my channel below for more videos on healing after cancer treatment. Radiation therapy is often used to treat breast cancer, but unfortunately it can cause issues like fibrosis, pain, and limited mobility in the areas that you had it done. These side effects of radiation therapy can last months or even years, so it's important to continue your mobility exercises well beyond the time that your radiation therapy finishes. For this video, we're going to be doing 5 exercises on a foam roller. So all you need for these exercises is a foam roller, and if you want, you can use a yoga mat to do this on the floor or just put it straight on the floor. I do not recommend doing these exercises on a bed or a soft surface. And if you do need a foam roller, I have a link in the description below for my Amazon storefront where you can get yours. Always check with your medical provider first before trying any new exercises, especially if you have fragile skin from radiation therapy. A little discomfort is okay with these exercises as you get into deeper stretches and movements, but you should not have any pain. If you do have pain, shortness of breath, or something just doesn't feel right, stop the exercise. For the first exercise, you're going to have the foam roller horizontal across your lower back, just below your shoulder blades. Your feet are going to be flat on the floor, about hip width apart or a little bit wider to help you keep your balance. You're going to have your hands behind your head and your neck to support it, and your elbows are going to be together like this. So you're going to first just come backwards over the foam roller and extending back, holding for a couple seconds, and then come back up. You're going to repeat that about 5 times. Again, holding for a couple seconds at each time that you go and extend backwards. After about 5 times at that location, then you're going to move yourself down so the foam roller comes up higher. So this is about at the level of my shoulder blades now. Then you're going to, again, do the same thing. So you're going to feel this a little bit higher up. You might feel a stretch across the chest too. That's a good thing. And so you're just coming back into that extension, hold a couple seconds, and then come back up. And again, you'll do this for about 5 times at each section as you work your way up the spine. After 5 times here, then you can move it up one more time, so you'll scoot yourself a little bit lower. And one more time, extending back, coming back up, extend back, hold that a couple seconds, and then come back up. So then you'll repeat that 5 times, elbows are together. And then at the very end, you can end with just coming all the way back down, get a nice extension into that thoracic spine. So for the next exercise, you're going to be lying on the foam roll so it's lengthwise. You want your bottom to be very close to the edge, so that your sacrum, your spine, and your head are all supported along the length of that foam roll. You want your feet, again, flat on the floor, a little bit wider than hip width apart. That's going to help you maintain your balance in this position. For this next exercise, we're stretching the pecs, and all you're doing is you're having your palms up, down by your side, and you're going to feel the stretch in the pec area where you had the surgery or where you had the radiation. You might find that you need to bring your arms out a little bit or maybe even into a field goal post kind of position to get that stretch. But all you're going to do is hold this position for about 1 minute. As you're in this position, doing deep breathing, really breathing into your chest and into your ribs, and feeling your shoulder blades and your arms fall down into the floor. For the next exercise, you're staying in this position, so you're staying lengthwise on the entire foam roll. Your whole body should be supported on the foam roll. Feet are supporting you and keeping you balanced. With this exercise, we're going to do elbow winging. So you're going to have your hands behind your head, elbows start out together, and you're going to gently and slowly open them up towards the ground. So you see that my elbow is going past neutral. It's going past the point of the foam roll and actually touching the ground. That's why I like doing this exercise on the foam roll, because you can really get into that full range of motion compared to if you were just doing it on the floor. So you're going to, again, start out with your elbows together and then slowly, gently bring your elbows out to the sides. Okay, if you bring your hands out, fingertips are just touching your ears. Hold that for a couple seconds. Feel that stretch across the chest, maybe even into your underarms, and then bring your elbows together. You'll repeat this exercise 10 times. Each time that your elbows are out, pressing down into the floor a little bit more. Hold for a couple seconds and then come back up. I'll show you one more time. So elbows come all the way down and out. Feel the stretch across the chest. Make sure you're not holding your breath with this. And then elbows come back up together. All right, the next exercise are angels. So you're still lying lengthwise on the foam roller with your sacrum, your spine, and your head all supported on the foam roll. You're going to start with your palms up, arms flat. And you're going to, as much as you can, keep your hands on the floor, keep your arms on the floor, and you're bringing your arms out to the side, up overhead like you're making a snow angel. Once you get to the top, then you'll bring your arms all the way back down. Again, you're bringing them out to the side. Try to keep your hands along the floor and all the way back down. So again, I like this exercise on the foam roll because you really get a lot more movement in the shoulder and the shoulder blade as you get up to the top. If you have a hard time and you can't keep your hand against the floor, that's okay, just do what you can. But again, just progressively work your way into those larger ranges and keeping your arms and hands against the floor. You can do this in sets of 10. And here's another view for the angel. So again, you're coming out to the side, all the way up so your arms touch, and bringing them all the way back down. All right, last exercise, we're still lying lengthwise along the foam roller. Feet are wide and flat, helping to keep you supported. You're gonna bring both of your arms straight up to the ceiling. Elbows stay straight this entire time. And you're going to bring one hand towards your legs, the other hand up towards your head, and you're extending that arm all the way back as far as you can. You'll feel a stretch into that upper arm and a little bit into the side of your chest, maybe into the armpit. And then you'll slowly bring them up together to meet. And then you're going to switch sides and bring that arm down and the other one up. Pause, bring both arms back up to middle, and then you're going to switch. So again, this movement is slow and controlled. You want to slowly progress your range as you get a little bit more comfortable and more flexible. This will start to feel easier. You can probably feel a little bit as you're moving your arms, your core working a little bit. Another good benefit of doing this exercise is you're getting a little bit of core work as you're stabilizing yourself. Again, with this exercise, slow controlled movements, and you want to do 10 on each direction for each arm. All right, excellent job with those mobility exercises. Remember to take it slow and listen to your body as you heal. I hope you found this video helpful with improving your mobility. Please give it a thumbs up, share with anyone who might benefit, and subscribe to my channel for more tips and exercises for your healing journey from your cancer treatment.